Well, good morning, everyone, and thank you for joining us today. My name is Patricia Carty. I'm the President and CEO of the Mental Health Center of Greater Manchester. We are here today to heighten awareness about the impact of the 2026-2027 New Hampshire House operating budget on our healthcare system, our providers, and the patients and families we serve. The House passed a budget yesterday that proposes significant cuts to critical services and programs that will have serious consequences for our healthcare system. These proposed cuts will put an immense strain on healthcare providers, particularly those serving our most vulnerable populations, and risk limiting both access and the quality of care that patients across our state rely on every day. These cuts are not just numbers on a page. They represent very real consequences for our hospitals, community mental health centers, federally qualified health centers, area agencies serving individuals with developmental disabilities, and our critical provider workforce. They will very negatively impact the state's Mission Zero program, which has seen progress recently in addressing the emergency room boarding problem. Most importantly, these budget cuts represent a direct threat to patient access to critical services and the ability of our healthcare system to respond to ongoing challenges, including timely access to care, rapid response in crisis housing, substance use recovery, housing for our mental health and developmental disability populations, uncompensated care, and as mentioned earlier, the ER boarding issue. We are here today to hear from healthcare professionals, patient advocates, and experts who are on the front lines of these challenges. We will hear about the tangible impacts on healthcare access, quality, and outcomes, and why it is critical that we find a path forward that ensures a healthier future for all New Hampshire residents. We hope this press conference brings attention to these pressing issues as we enter the state Senate phase of the budget. With that, I would like to turn the conference over to Greg White, CEO of Lamprey Health.
Thank you. Good morning, everyone. My name is Greg White. I'm the co-CEO of Lamprey Health. We're a federally qualified health center providing primary care, preventive care, behavioral health, and substance use treatment services to almost 17,000 patients from over 40 communities in New Hampshire. We have locations in Nashua, Newmarket, and Raymond. And as a community health center, federal law and our mission require that we provide our services regardless of a person's ability to pay or their insurance status. We are intended to increase access to care by reducing barriers, which include transportation, language, and lack of insurance. New Hampshire's community health centers serve over 100,000 granite staters and are an integral component of our healthcare safety net. Currently, almost 50% of health center patients are covered by Medicaid or have no insurance at all. Health centers are often the only primary care providers in our regions, making community health centers the state of New Hampshire's go-to answer for primary care. We work with hospitals, community mental health centers, and social service organizations to provide care to vulnerable populations and to those with a limited ability to pay. There are many examples across the state where safety net organizations partner to increase access to care. Among others, Lamprey partners with the Greater Nashua Mental Health Center and the Center for Life Management, which are both community mental health centers. We do this work to make primary health care and behavioral health services more accessible to our patients, and in doing so, we are able to break down systemic silos and to deliver the best health outcomes for our patients with multiple health care needs. Recently, the legislature made strides to improve access to care by increasing Medicaid rates, creating the Granted Advantage Health Insurance Program, Medicaid expansion, funding workforce initiatives, and eliminating the developmental disabilities wait list. This has helped us to address, as the safety net, the opioid crisis, to increase access to behavioral health services, and to increase access to oral health care services. Recently, the governor announced that New Hampshire saw a 35% decrease in opioid use overdoses from 2023 to 2024. This is a direct result of the actions taken by the legislature to improve access to care. We need to keep New Hampshire moving forward, and we ask the Senate and the governor to help us keep the train on the tracks. We fear the budget approved by the House will derail the train. New Hampshire's safety net system is being hit from all sides right now. Recently, the state of New Hampshire was forced to give back $80 million to the federal government. The safety net relies on federal funding and state funding and insurance reimbursements to simply operate. That $80 million loss meant that organizations like ours were forced to lay off our most precious resource, our staff. The proposed Medicaid rate reduction will cost New Hampshire's community health centers nearly $1 million. Lamprey alone will lose $150,000 in the first year. New Hampshire needs Medicaid rate increases, not decreases. We need our mental health services to be adequately funded. Granite staters who live with disabilities need their direct service providers to earn a living wage. We need workforce initiatives like the state loan repayment program in order to continue to meet the need of tens of thousands of patients that we serve. I'd like to now welcome Amy Moore, Vice President of Ascentria In-Home Care.
Good morning. My name is Amy Moore, and I'm Vice President of In-Home Services at Ascentria Care Alliance. I also serve as Board President for the Granite State Home Health and Hospice Association, which represents nearly 50 agencies across the state. For years, home care providers have delivered services through Medicaid programs like Choices for Independence, which is also known as CFI, private duty nursing, skilled home care, hospice, and supportive housing. These services allow medically complex children and adults to receive quality services in the comfort of their home. In-home Medicaid services reduce emergency room visits and hospital costs by providing coverage for preventative care and early treatment, ultimately lowering overall healthcare spending. In 2023, many of New Hampshire's home care providers face the risk of closure, including Ascentria, due to a severe funding shortfall in the CFI program. According to NHFPI, nearly $153 million underfunded. Tragically, our most vulnerable neighbors were left without care, suffering and dying alone in their homes. We are grateful that our legislature took action approving a historic rate increase to invest in CFI. It was a vital recognition that without consistent rate adjustments, we would soon find ourselves in crisis once again. Unfortunately, we now find ourselves in a similar predicament. Yesterday, the House passed a budget that directs DHHS to reduce all Medicaid provider rates by 3%. We cannot go back. A reduction in Medicaid rates would further destabilize an already underfunded home care sector and force agencies to cut services. Without sufficient funding, vulnerable residents will lose access to home care and be forced into hospitals and nursing homes, increasing costs and creating system-wide bottlenecks. Longer stays mean higher costs and much more expensive than home care. That will need to be passed on to New Hampshire's healthcare consumers. A strong home care system strengthens the entire healthcare system, providing care in the right place, at the right time, at the right cost. Strengthening our healthcare system means strengthening our economy, our workforce, and the well-being of thousands of Granite Staters. When I spoke with our members at the association earlier this week, the message was heartbreaking and clear. Out of just 23 provider agencies, 16 said that any cuts to Medicaid rates would force them to limit the number of Medicaid patients they can serve. 7 said they would have no choice but to lay off staff, and 7 more said that they would have to stop serving Medicaid patients altogether. As someone who has spent 17 years working in home care and over a decade as a caseworker, I've witnessed the profound impact these services have on individuals and families. I've seen people regain their independence, caregivers find support, and communities thrive because care was available when they needed it most. But I've also seen the other side. The despair when services are stripped away, the fear in families left to fend for themselves, and the irreversible harm that follows. These aren't just numbers, these are people, and their stories don't fade, they haunt me. Protecting Medicaid rates will keep people home in the least expensive care setting. The legislature invested in the value of home care last biennium, and we know that investment worked. At Ascentria alone, we were able to provide an additional 4,000 to 6,000 hours of care per month. By leaving the rate as is, they can continue to ensure that children and adults have access to the critical services they need. When New Hampshire residents have access to the right care at the right time and at the right location, it benefits us all. We urge the Senate and Governor Ayotte to reject any harmful cuts. I'd now like to introduce Marissa Berg, Executive Director at Community Support Network.
Good morning. My name is Marissa Berg, and I am Executive Director of Community Support Network Incorporated. And I'm here today representing the 10 state-designated, not-for-profit area agencies that serve individuals with developmental disabilities, traumatic brain injuries, and complex medical needs across the state of New Hampshire. Right now, the developmental disability community in New Hampshire faces serious and immediate threats due to major cuts in the budget. The programs that support thousands of children, adults, and families, community-based services, early intervention, residential services, employment supports, recreation, and respite care are all at risk. Funding is being stripped away without a plan to protect services or the people who depend on them. Nearly 300 individuals with developmental disabilities will be leaving school over the next 2 years and entering adulthood. These are individuals whose ability to participate in and contribute to their community depends on the very funding that has been eliminated from HB2. These supports are not luxuries. They are essential to daily life, safety, and dignity. They are essential to the families of these individuals. Without support, many family members of these young adults will have to leave their jobs to fill in the gaps. Elderly parents will continue struggling to support their dependent adult children at home despite their own health challenges, because there will be nowhere else for these families to turn. These proposed budget cuts would eliminate access to care to hundreds of people who qualify, reduce payments to providers already facing an unprecedented staffing crisis, jeopardize room and board services, forcing individuals into emergency rooms, institutions, or out-of-state placements at greater cost and with worse outcomes. Leave families waiting for months or even years for critical support, and accelerate the workforce crisis as low wages and increased pressure continue to push dedicated support providers out of this field. Workforce is the backbone of our system, and without workforce, services don't exist. Programs like early supports and services, which help infants and toddlers with developmental delays, are also at risk due to flat funding and staffing shortages. These early investments reduce long-term costs and help children thrive. Impeding them now only leads to more expensive challenges down the road. We need $62.8 million just to serve those entering our system over the next 2 years. And that's not a wish list, it's a basic commitment to care for some of the most vulnerable New Hampshire citizens. HB2 strips the ability for families to access new services, slashes funding for existing services, and will force existing programs to shutter, potentially leaving developmentally disabled and brain-injured individuals without a home. This is about more than money, it's about people. It's about stability, dignity, and ensuring that New Hampshire remains a state where all people and families can thrive. We urge our state leaders to stand with these critical agencies, programs, and community partners that care for New Hampshire's most vulnerable citizens to protect the services that matter and commit to building a compassionate, sustainable future for all. Thank you, and I'd like to introduce Kate Frey of New Futures.
Good morning. Excuse My name is Kate Fry, and I'm the Vice President of Advocacy at New Futures, a nonprofit, nonpartisan organization that works to improve the health and wellness of New Hampshire residents through policy change. Prevention, treatment, and recovery from substance use disorder has been the cornerstone of New Futures' advocacy efforts since the organization's inception in the late 90s. Our organization continues to prioritize this issue, ensuring that the state has the resources needed to sustain the full continuum of care for this disease that has affected so many individuals and families in our state. Our organization also understands that general funds are limited, so that is why New Futures, prevention stakeholders, and legislators champion an innovative, fiscally responsible approach to funding substance use disorder programs in the state over 20 years ago. The intent behind the creation of the Alcohol Abuse Prevention and Treatment Fund, also known as the Alcohol Fund, through law in 2003 was to direct 5% of gross profits of the very substantial revenue raised from alcohol sales in New Hampshire to substance use disorder initiatives. For the 26 and 27 budget years, 5% of gross profits are estimated at $10.7 million. A drop in the bucket compared to the $756 million in revenue raised by the Liquor Commission through alcohol sales. The Alcohol Fund supports hundreds of statewide prevention, treatment, and recovery programs administered through the Governor's Commission on Alcohol and Other Drugs without tying up valuable state general funds. The ask to policymakers for the budget regarding the Alcohol Fund is always simple. Utilize the Alcohol Fund for the intended purposes of supporting prevention, treatment, and recovery programs, and continue to fund the Alcohol Fund with the 5% of liquor gross profits for 26 and 27. While Governor Ayotte's budget committed to these principles, the House budget fell short. The budget that the House passed yesterday funded the Governor's budget at $10.7 million, Governor's Commission budget at $10.7 million, but the House chose not to utilize liquor revenue as originally intended by law. Instead, this revenue line will shift from liquor revenue to Opiate Abatement Trust Fund, which will require the cancellation of all opiate abatement contracts beyond May 2025. While New Futures understands the challenges of this budget year, this proposal essentially eliminates $10.7 million in state non-general funding to the entire system. At the same time, the state is facing the loss of millions of dollars in federal funding. Furthermore, proposed shifts in how the Governor's Commission programming is funded eliminates the state's ability to meet the needs of citizens struggling with alcohol, stimulants, and other non-opiate substances. More than half of the Governor's Commission contracts support non-opiate prevention, treatment, and recovery services. We also question the legality of shifting to the Opiate Abatement Trust Fund dollars to backfill the Governor's Commission on Alcohol and Other Drugs. The Opiate Abatement Trust Fund is comprised of funds from legal settlements with the opiate companies, which require that 95.5% of these settlement funds be used for opiate remediation. The New Hampshire statute reflects the national consensus limiting these funds to opiate abatement. The proposed elimination of $10.7 million of alcohol funds hampers our collective efforts to combat addiction and alcohol and other drugs and threatens successful and innovative programs such as New Hampshire Doorways, Recovery-Friendly Workplace, Peer Recovery Support Services, Juvenile Court Diversion, the list goes on. New Hampshire has made tremendous strides combating the terrible impact of overdoses and fatalities that have destroyed lives and families. Now is not the time to turn our back on those struggling with this disease. We call upon the Senate to continue to fund the Alcohol Fund with 5% of liquor gross profits in 26 and 27, as proposed in the Governor's budget. New Futures would also like to note the elimination of all state general funds to the New Hampshire Tobacco Control Prevention Program. This agency's primary goals are to prevent New Hampshire youth from beginning to use tobacco and to promote quitting among users. While New Hampshire has seen positive trends in reducing youth tobacco use, the concerning reality remains. 21% of 12th graders vape, 11% use frequently, and over half of those have tried to quit in the last 12 months. This demonstrates the impact of nicotine addiction and the industry that targets youth. This cut will mean elimination of all New Hampshire quit lines, including My Life, My Quit, which targets youth who are trying to quit vaping. To protect the progress made to ensure our youth's continued well-being, sustained investment in prevention and intervention efforts are essential. We ask the Senate to restore these funds to the Tobacco Control Prevention Program. I'll turn this back over to Patricia.
So I want to thank you again for being here and for your attention to these critical issues. As we've heard from our speakers, the potential impacts of the House budget are far-reaching, affecting not only the healthcare providers who dedicate their lives to caring for those in need, but also the most vulnerable populations who rely on these services to lead healthy, fulfilling lives. The challenges we face require thoughtful, sustained solutions, not further strain on an already stretched system. It's not too late to take action. We need to continue this conversation and work together to call for a budget that prioritizes the health of every New Hampshire resident. And now our speakers are open to any questions that anyone might have.
You mentioned in your remarks about uncompensated care. Can you talk a little bit more about how that impacts different agencies in the mental health?
I don't know if people want to speak to it. I'm willing to. Come on up. I'll share that.
So sure, we have a mandate to serve everyone regardless of their ability to pay. So when we were to lose funding, say from Medicaid, we still continue to serve our patients. So that cost of care is still there, but the offsetting revenue is not. So we'll see our free care or unreimbursed care grow substantially. As it is, we're well over $1 million now. And you know, as a break-even budget, it's hard to make that work when more of your services are not going offset. So from mental health center,
I think the same is true for community mental health centers. Per our rules, we have to serve people regardless of ability to pay. During the Medicaid unwind in fiscal year 24, the community mental health system as a whole had a little over $15 million in uncompensated care. The Mental Health Center of Greater Manchester alone had over $5 million in uncompensated care, and that is unsustainable. Our ability to have funding that allows us to provide the services that we are all trying to provide for these vulnerable populations requires a system that is funded adequately and also is able to compensate for these uncompensated care for those that don't have insurance or lose insurance or have insurance that does not pay for certain services that they require.
I think to expand on that too, from the patient perspective, going from a coverage under Medicaid to an uncompensated care situation, we're here to provide services as best we can, but they lose access to things like prescription coverage, diagnostics, inpatient substance use treatment, transportation. So kind of the wraparound piece that really helps them access care and completes their care is now at risk as well. So.
Could you speak in a little more detail about some of the programs at risk from this $18 million a year cut to community-based mental health programs? What programs are we talking about, and how would that impact the long-run ER care?
So I think, right now, we know sort of the number. It's hard to determine across the system the kinds of services that each center would need to eliminate. The fact of the matter is that a lot of the some of the work that we do, that where there is no compensation, are the areas that we would have to thoughtfully look at around continuing. So things like homeless outreach, things, services that may not be core to the centers are things that we would have to consider. All of it would impact the services that we're able to provide. It would impact our staffing, and therefore you would have things like more people in the emergency room trying to access care. You would have, last year we moved to a system where we have an open access system where people can walk in and get care, get an intake, same day they walk in. It would put us backwards in terms of that. Mission Zero, where the state in general and all the services have come together to reduce that ED boarding, we would then have waits again for hospital admissions. Increases in homelessness. All of, housing supports, for instance, might be something that we would have to consider. All of those areas would affect the quality of service that we give, the quantity of service that we're able to give, and our ability to have the staff to provide those services.
A quick follow-up, do you know if this would impact the rapid response, the mobile crisis teams?
Yes. So right now, the rapid response access point is part of the cuts that are proposed, and we don't know to what degree. And so yes, it might impact a system that has really been life-changing for so many people and life-saving for so many people. Any other questions?
So I know that you mentioned a little bit, but how do you really see this continuing to impact the progress that the state has made towards emergency department boarding?
Well, I think that it will directly impact that. If it impacts rapid response, which has been something that's been able to address crisis for individuals outside of the emergency room, meaning that you're meeting people in the community, in their home, in the school, in their primary care office, and being able to divert away from higher levels of care, divert away from emergency room assessment, because the assessments you can do in the community are exactly the same that you get in an emergency room. You will have more and more people in the emergency room, first of all, where there's no, the emergency room is not a place for people who have mental health crises. They're not equipped to manage that. It's not like you go in, you have a cut, you take care of it, it's gone. Mental health problems require a longer period of time to help people improve. And our ability to do that in the community is really crucial. As we have more boarding, people getting higher levels of care, requiring hospitalization because they're not getting the services, in the outpatient world, they will be requiring. It also delays people, right? So they're not getting the care they need, and then they're not accessing care. Their illness or their symptoms get worse, and by the time they reach the emergency room, hospitalization is often required. That boarding crisis will begin to happen again.
I was wondering if you could talk a little bit more about the impacts of the budget cuts on the Choices for Independence program.
Yeah, so CFI serves people basically, if you're on CFI, you are 18 or older and you are nursing home level of care. I'll tell you that just at Ascentria, about 60% of my census is actually under age 65. So these are individuals that have a woman in her 30s with, a really terrible MS. We see all sorts of diagnoses, and people are able to stay at home with their pets, with their loved ones. And I think this just speaks to, again, we are a system of care. We need nursing homes, we need hospitals, we need a strong, home and community-based care so that hospitals can discharge, right? If we don't have that strong home and community-based care, hospitals get overrun. It's just, for so many people, the health outcomes, the cost, all of it is just better. And people should have that opportunity to remain in their home with a little bit of support if they want to. And these cuts, as I said before, it was 2 years ago that at Ascentria, it was Ascentria and our friends Waypoint, who we went to the State House because we were at a point being underfunded by $153 million. We were at a point of making really, really difficult decisions, and we were going to have to close our doors. It was awful. And luckily, our legislature made that big investment, and that brought us whole. But that's what it did. It brought us whole so we could keep our doors open. Any other cuts would mean that we would be sitting down and facing those tough decisions again. And CFI serves over 4,000 people, I believe, in New Hampshire. So I just don't know what would happen if we keep seeing providers having to close their doors.
Just a question about, I'm noticing on the sheet, I actually didn't notice, but it looks like there's going to be some changes to the state loan repayment plan. And I recognize that that is one of the ways these organizations get physicians who generate revenue. Any comment on how that is going to be impactful on different organizations?
On behalf of Granite State Home Health and Hospice, I will say that we know that our neighbors in Massachusetts, we've seen over the years, right? We've seen a lot of our healthcare workforce move out of the state because of, as we talked about, housing costs and just pay. Look at inflation right now. The student loan repayment program has given people that opportunity to further their education and to start working. So many people, I mean, I frankly think of when I started out I was in my 20s doing this work. Most people, when you're starting out, you can't just front money for your education, right? Like, we don't just have money sitting around at that age or when you're just getting going. And that gave people the opportunity, right, to get into their classes, get their education, and get into the workforce where we desperately need people, especially in healthcare. Any cuts again to those programs, it's the same thing, right? It frankly feels like death by 1,000 cuts at this point. So yes, it would have huge impact.
I'll just add to that. One of the things that we know about is that our workforce comes out of school with tremendous loan debt. And you've heard about sort of our situation. We don't pay a lot. So one of the ways that we are able to retain our employees and also is a recruitment tool is the federal loan repayment, but also the state loan repayment. And at this point, the House has proposed that they will continue the people who are already in the program, but they will freeze any additional spots. And so right there, we're losing sort of the thing that we need in a workforce that is depleted.
I would just add to that too, Lamprey has 4 people in this program right now and 3 pending. So we don't just use it to bring people here, we use it to keep them here. And as we've noted, you know, it's kind of our people are our lifeblood. We're a service organization. So bringing in the professionals to provide care is challenged. And we use the loan repayment program to kind of level the playing field against an industry that may be a little better funded than we are.
Yeah. Mental Health Center currently has 15 people on the state student loan repayment plan. Anything else?
And I just had a question. Somebody mentioned in the remarks about housing and the impact on the developmental disability population.
Yeah, so one of the cuts that is going to be impacting us is initially DHHS had recommended prioritized having a $5 million per year allocated to housing. Right now, housing services are not something that is reimbursed under Medicaid. And we are currently seeing provider agencies lose thousands of dollars every month in lack of compensation for helping meet those needs. So they are facing shortages that they have shared that they will be closing homes if they do not have compensation this coming biennium. Any other questions?
I have one more on the community mental health angle. After the Great Recession, I know there were a series of cuts to the mental health system, and that was sort of, one of the things before the sort of hoarding crisis ramped up. I'm just wondering if this feels reminiscent to that, or how this compares to sort of background.
Certainly reminiscent, unfortunately. I think one of the things, though, is that over the last 4 years, there's been an investment in the system, and we have made significant strides. The state, as well, has embarked on a commitment for the community mental health centers around certified community behavioral health centers, which is a national model that really focuses on integrated whole person care. 2 of the mental health centers, this mental health center in Manchester and the mental health center in Nashua, currently both have their certifications and have, as of 1/1, embarked on a cost-based system, which really is something that we have never experienced. So for the community mental health centers, we've made certain strides in the last 4 years, and those strides are currently at risk. This cut and any changes to the funding will then not only stop sort of our progress moving forward, but it is going to push us back. And the reality of that is the impact is on the people that we serve. And the adults, the kids, their families, our older adult population who is in greater need, all of they're really the impact. So. Okay. Looks like we're done our questions. So thank you again. We appreciate you coming.